In this video, we will examine the use of molecular hydrogen, also known as hydrogen gas, during cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. How can a gas kill cancer? How can the smallest, most prevalent molecule in the universe can greatly inhibit cancer? Because of its minuscule size and electric neutrality, hydrogen gas can penetrate any cell in the body and reach its peak concentrations in organs within minutes. A history of therapeutic hydrogen. In 1975, Dr. Malcolm Dole et al. Showed that hyperbaric 97.5% hydrogen and 2.5% oxygen killed cancerous tumors in mice. Yet even though this study was published in the prestigious journal Science, there was very little follow-up, and by 1980 research into therapeutic hydrogen came to a halt. Outside of research circles, there still were anecdotal reports about hydrogen's health benefits. For instance, a TV program called The Truth of Holy Water aired on the Discovery Truth channel in Japan in 1998. It showed an abandoned mine pit in Nordenau, a small town in Germany. Every year, thousands of people with a variety of diseases go to Nordenau to find holy water from the mine to cure their illnesses. To quote a summary of the program, in April 1986, a group of children who suffered from leukemia resulting from the Chernobyl nuclear disaster were brought by the owner, Theo Tom, of the mine to drink the holy water. A few months later, most of the children presented with significant symptomatic improvement. Among them, one case showed complete recovery. These results caused a mass uproar in the media. Subsequently, it was discovered that the patient's improvements and recovery were due to the large amount of hydrogen gas contained in the holy water. Research into the therapeutic effects of hydrogen wouldn't resume in earnest until 2007, when Japanese scientists demonstrated molecular hydrogen could prevent and heal injuries in animal models by scavenging reactive oxygen species, highly reactive chemicals formed from oxygen that can damage cells. Effects on other illnesses. Beyond its effects on cancer, hydrogen has remarkable effects in other serious conditions that deserve mentioning. In human trials, it has been shown to improve symptoms of Alzheimer's, Parkinson's, cardiovascular disease, post-cardiac arrest syndrome, stroke, visceral fat deposits in non-alcoholic fatty liver disease. It has also been shown to improve athletic performance and metabolic function. How does hydrogen gas work? The first way hydrogen works against cancer is by selectively scavenging the most powerful reactive oxygen species, ROS, which are hydroxyl and peroxynitrite. Many cancer treatments, such as radiation, typically work by raising ROS, not by lowering it. Fortunately, and somewhat surprisingly, hydrogen does raise ROS in cancer cells after the initial drop. Additionally, molecular hydrogen improves mitochondria function. Mitochondrial dysfunction is a foundational cause of cancer. Rejuvenates CD8 cells, the immune cells that do the actual killing of cancer. Balances the TEH1/TH2 immune response, which is basically restoring balance between inflammatory and anti-inflammatory reactions. Inhibits excessive autophagy, one way cancer protects itself, while promoting autophagy that protects healthy tissue. Hydrogen as a cancer monotherapy. There are reports with hundreds of people using hydrogen in conjunction with other therapies, but there are, at this moment, only reports of 30 people using hydrogen as a monotherapy, meaning as the one treatment they are receiving. 2 of those people have their stories recorded as case studies, and the other 28 are included as participants in a larger study. The first case study is of a 72-year-old woman with stage IV gallbladder cancer. She was diagnosed with gallbladder cancer in December of 2017. By October of 2018, her condition had deteriorated so much she was only able to inhale hydrogen gas as a sole treatment modality, no other pills or chemotherapy. She had never received hydrogen before. Her cancer was so aggressive that after the first month of hydrogen inhalation, it continued to grow. But by the second month, hydrogen began to turn the tide and her tumors began shrinking. After 2.5 months, she had her gastric tube removed and showed normal blood and tumor markers. In another case study, a 44-year-old woman had multiple brain metastases and hydrocephalus accumulation, buildup of fluid in brain ventricles. She had already had brain surgery and chemotherapy. At the presentation of new brain metastases, she refused radiation and brain surgery and signed an informed consent to receive hydrogen monotherapy. She inhaled 66% hydrogen and 33% oxygen at a rate of 3 liters per minute for 3 to 6 hours a day. To quote the authors, after 4 months, most brain metastases disappeared, and the amount of hydrocephalus in the third ventricle and lateral ventricles were both reduced. After 1 year, all visible brain tumors had disappeared, and there were no obvious changes in metastases in the liver and lung. Here is a picture of her brain scan. Hydrogen as a concurrent therapy. Anyone who has been through any type of cancer treatment knows there is a great chance of serious side effects. Serious side effects can derail treatment or even cause death by themselves. So, it is very reassuring to see that hydrogen not only synergizes with every cancer treatment that we're aware of, but also reduces side effects. For instance, 42 stage 4 non-small cell lung care patients received hydrogen gas in combination with Opdivo, the widely used anti-PD-1 immunotherapy drug, and 14 received Opdivo by itself. The use of hydrogen lasted for a maximum of 60 months. The median survival time for the Opdivo and hydrogen group was 28 months. The Opdivo-only group had a median survival time of 9 months, a more than 3-fold difference. A study in 55 stage 4 colon cancer patients also found an improvement in the function of CD8 cells and an improvement in overall survival. The overall survival was 31.4 months. The historical average for stage 4 colon cancer patients is 15 months, so survival more than doubled. The people inhaled hydrogen gas for 3 hours a day, the lowest amount of time I've seen in any study. It's normally 4 to 6, for a total of 3 months daily. In people with leukemia, inhalation of hydrogen gas protected bone marrow from radiation-induced side effects without compromising efficacy. The suppression of bone marrow can be life-threatening for people with leukemia. In another study, hydrogen, this time in water, protected the liver during chemotherapy treatment. 80 people who had advanced colon cancer consumed 1 liter a day of hydrogen-rich water for 4 days during chemotherapy treatment. Their liver enzyme levels barely increased, while the control group's ALT and AST liver enzymes approximately doubled. Alkaline phosphatase, ALP, a key marker of liver damage, also increased more in the placebo group. How much hydrogen is in the hydrogen-rich water is not defined, but the study went on from 2010 to 2016. Our ability to suffuse hydrogen into water has greatly increased since then, so we would imagine you could reach the concentrations they reached, or higher, with a typical low-cost hydrogen water machine. Numerous other positive human trials are quoted in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. How to obtain the simplest and most affordable way to get more hydrogen for most people is to buy a hydrogen water machine. These machines are small, portable, and can produce 2,000 parts per billion of molecular hydrogen per glass of water which is a lot. They also are not too expensive, about $100 or so. There are also tabs that can be put into water to generate hydrogen. It seems like the best of these are sold by Dr. Mercola. The Mercola brand can put about 7,000 parts per billion into water. Some other brands also put aluminum into the water. Mercola's doesn't. Another route to go is to purchase a molecular hydrogen gas concentrator. There are ones currently in America that are available for a few hundred or a few $1,000s. The only bad part is that they do not meet the outflow used in every human trial of molecular hydrogen gas, a minimum of 3 liters per minute. Mind you, this is not 3 liters just of hydrogen gas. It is actually 2 liters of hydrogen gas and 1 liter of oxygen, a mixture known as Brown's gas, which has been used in scuba diving for many years. If you get a straight hydrogen concentrator, there won't be any oxygen to breath. Another tip on consuming hydrogen water: it's best to consume it quickly, virtually in one gulp, because the hydrogen can dissipate quickly and is sensitive to jostling. Again, much more about molecular hydrogen is discussed in the book Cancer Self-Defense 101. Quick tips to help you survive.